the kind of relationships that we can foster in both business and government, but so that the members of this Senate, of this Congress, and our people here get a better sense of them as well. I think that is very important as we track forward with this new, young government that is now embarking on writing a Constitution and governing in a vitally important country in the Middle East. And I, at this point, would like to turn things back to the good senator from Arizona with my sincere gratitude.
Well, I'd just like to thank my colleagues and dear friends. It was an exciting trip and a very interesting one. And I'd just like to say that, you know, when you go to a country like Libya and see the challenges they have with the militias and yet the dedication of their leadership towards a free and democratic country, when you go to, well, in Libya, where both the Prime Minister and the Deputy Prime Minister both attended school or were professors at the University of Alabama, it really does show the incredible effect of an education in the United States of America. And
for just 1 second.
You know, extremists, but anyway.
Not only did we meet people who came back to Libya from the University of Alabama, if there had been anybody from North Dakota, would have known about it, I assure you. And I'm sure there'll be people in the future. We met with a person who was detained at Gitmo. Now, you talk about a small world and how the world changes. Someone that was detained at Guantanamo Bay because they had been involved with some very unsavory characters, but who did not adopt the al-Qaeda agenda, but will be a key player in the relationship between Libya and the United States. And I just want to mention, I think my colleagues will verify this, and, you know, you've been nice to Senator McCain and myself, but let me tell you, having the three of you there, as Senator Blumenthal said, echoing public opinion in America. We weren't negotiators. We were trying to tell people the way it was here at home, and you couldn't have done it without the three of y'all basically saying, here's the way it is. But let me just say that when Senator McCain turned to the former Guantanamo Bay detainee and said, you know, I've been in prison too, and about forgiveness and about starting over, about starting the relationship with Vietnam, Senator McCain and Senator Kerry did that, and about understanding that the future is what we want it to be. I thought it was a very moving moment. I thought the interaction between the two individuals gave me a sense of, you know, there's hope out there. And I just want to acknowledge that that was an unusual moment when you meet someone who had been in Guantanamo Bay, who is now one of the future leaders of Libya, and have a senator from the United States Senate who served his country and was a prisoner of war. That was an incredible exchange, and I hope something good comes from it.
The Senator yield for a moment.
Please.
You know, it was an extraordinary moment, but even more so because Senator McCain asked a number of them, one in particular, about the impacts on their families. And in that case, I believe, the impact on his wife. We tend to forget in this country, we tend to take all too often for granted the immense protections that we enjoy in this country, the value of our freedoms. And that moment was profoundly moving for me in his reaction, in the realization of how far he has come as a leader in his country, how much he's endured, how much pain and travail for him and his family. And so it was a striking reminder about the importance of democracy and freedom and the protections that we often take for granted, and the great work being done by those non-governmental organizations in fostering freedom and democracy, and sometimes at peril or risk to themselves. But I think that the senator from South Carolina has hit a very important point, and it ties to what Senator McCain said about the suppliers conference in Egypt, that these principles and the growth of democracies in that part of the world are important, not just because we like democracies and not just because of the strategic value militarily and the interests that our national security have, but also they are potential markets for our exports. senator from South Carolina, used that word. People should understand that there is an important interest that we have in promoting jobs in those countries because it will mean jobs for us. And that is, at a very basic level, one of the values of this trip in trying to promote and expand those markets, as Senator McCain did in speaking to the Suppliers Conference in Cairo. A ballroom, literally, hundreds and hundreds of Egyptian businessmen wanting to do business, buy our products, and expand their markets so that we will have more jobs. Thank you, and I yield.
Note the presence of my colleague from Vermont. I would just like to again thank my colleagues. You know, every once in a while you can think we did a little bit of good around the world, and thanks to the the five of us, I think we really did, and I think we can be proud. And we're also very proud that we represent still, in their view and our view, the greatest nation in the world. Madam President, I yield the floor. Suggest the absence of quorum.
Clerk will call.
I don't suggest the absence of quorum.
Madam President, I request 10 minutes to speak in regard to the Hoeven-Blumenthal resolution.
Is there objection? Without objection, so ordered.
Senator Reid is going to come fell the tree on the highway bill. Arnie.
Mr. President, I rise to speak on the Hoeven-Blumenthal resolution, and also, in addition to requesting 10 minutes, request that my co-lead sponsor on the resolution, Senator Blumenthal, be allowed to engage with me in this discussion. We have introduced a resolution calling for free and fair elections in Iran. Those elections will be held tomorrow, March 2nd, and it's the first time that the Republic of Iran has had nationwide parliamentary elections since June 12, 2009. I'd like to thank Senator Blumenthal for joining me in this resolution, also Senator Lindsey Graham, Senator Joe Lieberman, Senator Kelly Ayotte, and as I say, I think we are now over 60 sponsors on this resolution and working to see that it passed the Senate here very quickly. It expresses a sense of the Senate clearly calling for open, free, and fair elections in the Republic of Iran. The problem is that the elections that they will be holding tomorrow are neither fair, neither free nor fair, and they are certainly not consistent with international standards. As I said, these will be the first nationwide parliamentary elections since June 12th of 2000. They provoked widespread protests throughout Iran. Those protests were brutally repressed, put down by the regime of Ayatollah Khomeini and President Ahmadinejad, trampling on human rights and taking political prisoners who remain in prison to this very day. Since the last elections, uprisings, popular movements for self-determination have taken place throughout the Middle East, often referred to as the Arab Spring. Countries like Tunisia, Egypt, and Libya, other places as well. And we want to support that right for self-determination in Iran, for the people of Iran as well. Right now, the only people that can run for office in Iran are people that are approved to run by the regime itself. They have the Council of Guardians, and the Council of Guardians has to approve anyone that wants to run for office. So the reality is, the government itself, the regime itself, decides whether or not you can run for office. And about something over 5,000 individuals applied to run for government. Of those 5,000, about 3,000 were approved by the Iranian regime to run. More than 2,000 were denied, so they can't even run. Well, how can you have a free or a fair or an open election that meets independent standards, when the government itself decides who can run and who can't run? doesn't work. That's not the way elections should work. And America truly is a force for freedom and for democracy in the world. And that's why we're working to call the attention of the world to these elections. It is particularly important at this time that we stand with the Iranian people in calling for free and fair elections as we impose sanctions to try to prevent the government from developing a nuclear weapon. We want to make very clear that while we need to impose strong, consistent sanctions that prevent the Iranian regime from attaining a nuclear bomb, at the same time we support the Iranian people's right to self-determination. Mr. President, at this point, I will yield the floor. I see that the majority leader is here, and I will yield the floor and reclaim my time after for my colleague, Senator Blumenthal.
Mr. President,
Majority Leader.
it's my understanding the business before the Senate now is a surface transportation bill. Is that right?
Senator is correct.
Does that need to be reported, or we're on it?
It is already pending.
Mr. President, I withdraw amendment number 1730.
Senator has that right.
I have a first-degree
The
amendment.
amendment is withdrawn.
I have an amendment that's at the desk.
Clerk will report.
Senator from Nevada, Mr. Reed, proposes an amendment numbered 1761. Strike all after the first word and insert the following.
As further reading, the amendment be waived, and I ask for the yeas and nays on the amendment.
Is there a sufficient second? There appears to be. The yeas and nays are ordered.
I have a second-degree amendment at the desk, Mr. President.
Clerk will report.
Senator from Nevada, Mr. Reed, proposes an amendment numbered 1762 to amendment numbered 1761. At the end, add the
As
following.
further reading, the amendment be waived.
Without objection.
I have a motion to recommit the bill with instructions, Mr. President. That is at the desk.
Clerk will report the motion.
Senator from Nevada, Mr. Reed, moves to recommit the bill S-1813 to the Committee on Environment and Public Works with instructions to report back forthwith with an amendment as follows.
I ask further reading of that be waived, Mr. President, and ask for the yeas and nays on that motion.
Without objection.
17.
Is there a sufficient second? There appears to be. The yeas and nays are ordered.
I have an amendment at the desk.
Clerk
That
will
amendment
report.
that is to the instructions that we've already set forth.
The Senator from Nevada, Mr. Reed, proposes an amendment numbered 1764 to the instructions, amendment numbered 1763, of the motion to recommit.
Mr. President, on that, I ask for the yeas and nays.
Is there sufficient second? There appears to be.
I have a second-degree
Yeas
amendment.
and nays are ordered.
I have a second-degree amendment at the desk.
Clerk will report.
Senator from Nevada, Mr. Reed, proposes an amendment numbered 1764 to amendment numbered 1765.
Mr. President, I ask further reading be waived.
Without objection.
Mr. President, let me take just a moment to review where we are on this important surface transportation bill. No one disputes the fact that this is a job creator. Millions of jobs, plural. Today, with the Senate's vote to dispose of the Blunt Amendment, the Senate completed an important step to try to advance this bill. The Republican leader and others on the Republican side had made clear that they wouldn't allow the Senate to move forward on this piece of legislation until they got a vote on contraception. We waited, and we waited, and we waited. It's done. And now we can move on to attempting to process other amendments to this important piece of legislation. Now, not everything ground to a halt while the Senate was working toward processing the Blunt Amendment. The bill's able managers have been working to clear amendments offered by a number of senators. As I've said before, the managers of this bill, multiple in nature, are seasoned and know what's going on legislatively. But they've worked together. Boxer and Inhofe especially, because there's more of what they have in this bill than what the other committees have. But we have the Banking Committee, we have the Finance Committee, we have the Commerce Committee, and they've all worked to coming up with a number of cleared amendments. All these senators have worked closely together. They worked so closely, even before their work of the past week, that on February 9th, 85 senators voted in vote cloture on the motion to proceed to the bill. And as I've indicated, over the last several weeks, they've continued to work together and clear numerous amendments that senators had filed. I offered a revised amendment a few minutes ago. This amendment includes the very same consensus work that comes from the product of these three committees regarding my earlier amendment. It includes matters reported unanimously by the Banking Committee, strong bipartisan vote in the Finance Committee, matters negotiated between the chairman and ranking member of the Commerce Committee. What's new in the amendment that I just offered is that it now also includes 37 additional amendments cleared by the managers of this bill, and where appropriate, cleared by other committees, specifically the Commerce Committee and the Banking Committee. 37 amendments. So that's now part of my substitute that's now before the Senate. I would be very satisfied if the Senate adopted this amendment, provided that it would serve as original text for purpose of further amendment. The two managers will continue to work to clear additional amendments. But, Mr. President, we need a path forward on this bill, and we don't have it now. We continue to work on an agreement to have votes on a number of non-germane amendments on which the Republican caucus say they want. On our side, if they want amendments, we could have some non-germane amendments also. I'd rather we disposed of the non-germane amendments. And I am thinking seriously of coming to the floor today and asking consent that we move forward on this bill with no irrelevant or non-germane amendments. It's vital that we complete work on this surface transportation bill. I'm determined that the Senate will do so, and do so as quickly as possible. Doing so will take cooperation from different senators. So we need to keep our eye on the road. We need to get this legislation passed. Saving or creating up to 2.8 million jobs is the destination of this path that we're seeking. Let's work together to get there as soon as possible, Mr. President. I appreciate my friends, Senator Hooven, Senator Blumenthal, allowing me to proceed with this matter of importance to the Senate.
Mr. President, I ask to reclaim the balance of my time.
Senator from North Dakota.
Again, I want to thank good Senator from Connecticut for working with me on this important resolution, recognizing the right of the Iranian people to self-determination. I also want to thank our colleagues, as I say now more than 60, who have joined us on this resolution, and also look forward, as I say, to quick passage. With that, I would like to turn the floor over to my colleague, the good Senator from Connecticut.
Mr. President.
Senator from Connecticut.
Thank you, Mr. President, and thank you to the Senator from North Dakota for his leadership on this very, very important issue. I want to thank him for his perseverance and his vision in seeing the importance, along with Senator McCain, Senator Graham, Senator Sessions, of this kind of effort, which really had its genesis in the trip that we took to Afghanistan, Egypt, Israel, Tunisia, and Libya. What impressed us so much is how democracy is growing and starting there, and in that part of the world, how the dictatorship and tyranny of Iran are such a contrast with the hopeful, burgeoning democracies that are growing there. And that is the reason that so many of our colleagues, now I believe it's 57, and I want to ask unanimous consent that Senator Klobuchar of Minnesota be added as a co-sponsor. That is the reason why so many of them have joined.
Without objection.
I am honored today to speak in support of the Hoeven-Blumenthal resolution calling for free and fair elections in Iran and condemning the government of the Islamic Republic of Iran for its ongoing violations of human rights. These violations are brutal, tangible, real in their impact on individual lives in that country. And our hearts go out to the people of Iran, particularly the individuals there fighting for freedom and democracy. The world has watched the Arab Spring bring down dictators in Tunis and Tripoli, and the people of Iran continue to be denied those basic human rights that we hold dear and should be universal. I also want to thank Secretary Clinton for her tireless work in this region. She arrived in Tunis shortly after we left to consult with all nations interested in aiding the Syrian people. And she showed again her dedication to this same cause of human rights through her leadership there. I saw in our meetings with the new generation of leaders that are emerging in the Middle East how dramatically the statements we make here, the actions that we take, impress them in their fight for basic human rights. How we're speaking out here for universal suffrage and freedom has an impact on what they do. And perhaps many of them in our own country need to be reminded about the importance of what we say and do here. The parliamentary elections that will occur on Friday in Iran will be neither free nor fair. They've already taken actions to assure that it will be, as one observer said, the fakest one yet. But the brutal repression and human rights going on there are too real for those who suffer at that government's and that regime's hands. As the resolution makes clear, Iran has already disqualified 2,200 candidates from actually running for office, simply based on their political views. And it maintains severe restrictions on the press, strangling a free press, preventing even the Voice of America and Radio Free Europe from reaching the people of Iran. Having created a sham election, a travesty, and a tragedy, the Iranian regime now will try to force Iranians to vote at the polls in an effort to show popular support. Force them to vote simply to show this sham support. The truth is, it has no such support. Allowing international monitors to bear witness, as we demand in our resolution, would reveal these acts of repression for what they are and for the world to see. The last nationwide election held in Iran on June 12, 2009 was widely condemned throughout the world. Following the election, there was brutal repression, documented all too dramatically by the videos and other evidence that, in effect, was smuggled out of Iran, although in real time. And that large campaign of politically motivated violence, intimidation, repression, torture, cruel and degrading treatment, including rape, executions, and extrajudicial killings and indefinite detention, all are well documented. On December 26, 2011, the United Nations General Assembly passed a resolution denouncing the serious human rights abuses occurring in Iran. The Hoeven-Blumenthal resolution lets the people of Iran know that we are with them, they are not alone, we side with them, we stand and speak out on their behalf, because they are not forgotten in their effort for democracy. The Middle East's future will be determined first and foremost by the people of the Middle East themselves. But American strength, vision, leadership are absolutely essential, and so in that regard I am very proud and grateful for the 60 co-sponsors of this resolution, now 61 with Senator Klobuchar, and I thank again the senator from North Dakota and yield the floor.
President.
Senator from North Dakota.
I, too, want to again express my appreciation to Senator Blumenthal and to all of our co-sponsors, and look forward to passage of this important resolution. With that, I yield the floor, Mr. President.
Mr. President.
Senator from Minnesota.
Thank you, Mr. President. I thank the two senators here for their good work on this very important resolution. I come to the floor today on another topic, and that is to thank and congratulate the House of Representatives, who earlier today handed a great victory to the people of Wisconsin and Minnesota by passing legislation that will finally allow construction to begin on a stronger, safer bridge in the St. Croix River Valley. After 30 years of debate and delay, we have finally gotten it done, and I'm proud to say we got it done with broad support in both chambers. The legislation that I introduced in the Senate to allow this bridge to be built passed unanimously in January, and our Senate bill has passed the House today with the overwhelming backing of 339 members, making the final vote count 339 to 80. This was truly a team effort, and it is an inspiring example of what we can accomplish when we are willing to put politics aside and come together to do what's right for the people that we represent. I want to thank my colleagues in the House for their hard work and dedication in moving this legislation forward. Representatives Ron Kind, Sean Duffy, Michelle Bachmann, Chip Kravac, and Tammy Baldwin. I also want to thank Secretary Ray LaHood and his staff at the Department of Transportation, as well as Governors Mark Dayton and Scott Walker for their leadership at the state level. In both Minnesota and Wisconsin, there is overwhelming consensus about the critical need for a new bridge in the St. Croix River Valley. There are sometimes disputes on what that bridge should look like, but there tends to be consensus that we simply can't have a lift bridge from the 1930s with 18,000 cars going over it. The current lift bridge, as I mentioned, was built in 1931. Chunks of rusting steel and concrete fall off it and into the river below. Traffic backs up behind it, especially in the summer months, sometimes for a mile, with cars lined up by houses, cars lined up by businesses, and it is not a desirable situation for anyone in the town of Stillwater. The Minnesota Department of Transportation has listed the bridge as being structurally deficient and fracture critical, meaning that if one component of the bridge fails, the entire structure fails. Simply put, the bridge cannot meet the needs of the region, neither in terms of public safety nor in supporting traffic caused by a growing population. As the bridge has aged, we've seen significant increases in congestion. This is an especially big problem in the summer months when the bridge lifts frequently to allow watercraft to pass, causing traffic to back up on both sides of the bridge, increasing gridlock and air pollution, hindering economic activity and threatening public safety, particularly when emergency vehicles are unable to pass through. Now here's the numbers. The current structure was designed to support 11,200 vehicles a day. It cannot handle the average 18,400 cars that cross it every day, let alone anticipated increases in usage. But with this new bridge, 48,000 vehicles will be able to cross safely and efficiently every day. This is clearly important from a public safety perspective, but it also means new channels for economic growth. Without a new bridge, anticipated usage would reach 23,500 by 2030. With a new bridge, anticipated usage will reach 43,000 vehicles per day. Those 20,000 additional vehicles will mean more opportunities for local industry and more customers for local businesses, made possible by an infrastructure capable of supporting new growth and development. When you look at the numbers, it is easy to see why my Senate legislation was able to pass not only the Senate without any opposition, but it is easy to see why the House passed the bill by such a wide bipartisan margin today. We are less than an inch away from the finish line, Mr. President, and now we need the President of the United States to sign the bill. I spoke with Secretary LaHood this morning. I don't anticipate it to be an issue. He was very positive about the bridge, but we need a prompt signature. The people of Minnesota and Wisconsin have already waited 30 years. They cannot afford to wait any longer. We cannot afford to delay. It's time to finally get this bridge done. I want to once again thank all of my colleagues who worked hard to advance this bill. Michelle Bachmann in the House led the effort on the Minnesota side, and I led the effort in the Senate. I want to thank the other senators who were so good to support this bill, Senator Franken, Senator Cole, and Senator Johnson. I look forward to standing with all of my colleagues when the President signs this into law. I look forward to standing with you again on that proud day in the near future when we finally break ground on a stronger and safer bridge for the St. Croix River Valley. Thank you, Mr. President. I yield the floor.
Mr. President.
Senator from Maryland.
Thank you, Mr. President. Mr. President, today I come to the floor to mark the 5th anniversary of DeMonte Driver's death. DeMonte was a 12-year-old who lived in Prince George's County, Maryland, only a few short miles from here. He died 5 years ago at the Children's National Medical Center in Washington, D.C., from a brain infection brought on by an untreated tooth abscess. The driver family, like many families across the country, lacked dental insurance. At one point, his family had Medicaid coverage, but they lost it because they had moved into a temporary shelter and their paperwork fell through the cracks. When advocates for the family tried to help, it took more than 20 calls just to find a dentist who would treat him. DeMonte began to complain about headaches on January the 11th. Then an evaluation at Children's Hospital led beyond basic dental care to emergency brain surgery. He later experienced seizures and a second operation was required. Even though he received additional treatment and therapy and he appeared to be recovering, medical intervention came too late. By the end of his treatment, the total cost to our health care system exceeded $250,000, more than 3,000 times the $80 it would have cost for a tooth extraction. The DeMonte driver passed away on Sunday, February 25th, 2007. DeMonte's death was a national tragedy. It was a tragedy because it could have been prevented if he had received timely and proper basic dental care. It was a tragedy because it happened right here in the United States, in a state in one of the most affluent states in the most affluent nation. It happened in a state that is home to the first and one of the best dental schools in the nation, the University of Maryland. It happened in Prince George's County, whose border is less than 6 miles from where we're standing here in the United States Capitol. I have spoken here on the Senate floor about the DeMonte driver several times since that tragedy. In the intervening years in both my home state of Maryland and nationally, we have made progress. When DeMonte's case was brought to light, I believe that it served as a wake-up call to our nation. It brought home what former Surgeon General C. Everett Koop said: there is no health without oral health. Medical researchers have discovered the nexus between tooth plaque and heart disease. The chewing stimulates brain cell growth, and that gum disease can signal diabetes, liver ailment, and hormone imbalances. They have identified the vital connection between oral health research and advanced treatment like gene therapy, which can help patients with chronic renal failure. They know that intervening in basic dental care can save money down the road in costly medical interventions for other diseases. But for all their research finding, without insurance coverage and adequate access to providers, we know that millions of children and adults will have oral health care needs that remain unmet. That is why the progress we've made over the past 5 years is so important to America's health. So I've come to the floor today to talk about what we have achieved and how we can move forward as a nation to ensure better access to oral health care. The Maryland delegation is proud that Maryland has emerged as a national leader in this area, launching a $1.2 million oral health literacy campaign, raising Medicaid reimbursement rates for dentists, and providing some allied health professionals and hygienists the opportunity to practice outside of the clinics. Today, the DeMonte Driver Dental Project van, which was dedicated in front of the U.S. Capitol in May of 2010, provides services in the underserved neighborhoods in Prince George's County, thanks to the efforts conceived and launched by members of the Robert T. Freeman Dental Society. This society, an arm of the National Dental Association, is named for Dr. Robert Tanner Freeman, who in 1869 became the first black graduate of the Harvard School of Dental Medicine. Congressman Elijah Cummings and I were joined that day by Ms. Alice Driver and her sons, the project's co-founders, Dr. Hazel Harper and Belinda Carver Taylor, and the National Dental Association's president, Dr. Walter Owens. In 2009, 2 years after DeMonte's death, Congress took up the reauthorization of the Children's Health Insurance Program. In a frustrating attempt to locate a dentist for her child, DeMonte Driver's mother and her advocates had to contact numerous offices before locating anyone who would treat him. For a variety of reasons, it's difficult for Medicaid and CHIP enrollees to find dental care, and working parents whose children qualify for those programs are likely to be employed at jobs where they can't spend 2 hours a day on the phone to find a provider. So part of the CHIP Reauthorization Act now requires HHS to include on its Insure Kids Now website a list of participating dentists and benefit information for all 50 states and the District of Columbia. Also, in 2009, Congress passed the Edward M. Kennedy Serve American Act. That law created the Healthy Futures Corps, which provides grants to states and nonprofit organizations so they can fund national service in low-income communities. It will allow us to put into action tools that can help close the gap in health status, prevention, and health promotion. For too long, we have acknowledged health disparities, studied them, written reports about them. With the help of the senior senator from Maryland, my colleague, Senator Barbara Mikulski, we added language to that law specifying oral health as an area of focus. Now the Healthy Futures Corps can help recruit young people to work in the dental profession where they can serve in areas where we have shortages of providers both in urban and rural areas. It will fund the work of individuals who can help parents find available oral health services for themselves and their children. It will make a difference in the lives of the Healthy Futures Corps members who will work in underserved communities and in the lives and health of those who get improved access to care. Then, Mr. President, in 2010, we passed the Affordable Care Act, which guarantees pediatric oral health care as part of each state's essential benefit health care package. The law also establishes an oral health care prevention education program at the Centers for Disease Control and Prevention, targeted towards key populations, including children and pregnant women, and it creates demonstration programs to encourage innovation in oral health delivery. It also significantly expanded workforce training programs for oral health professionals. Moving forward, the states have a critical role to play in ensuring that the Affordable Care Act benefit is designed to incentivize prevention, recognize that some children have greater risks of dental disease than others, and deliver care based on their level of risk. Among the most cost-effective ways to improve children's health care are investments in prevention. Dental salients, clear plastic coatings applied to the chewing surface of molars have been proven to prevent 60% of tooth decay at 1/3 the cost of filling a cavity. So we must make sure that prevention is a key part of every state's benefit package. Further, in 2010, the United States Department of Health and Human Services launched its Oral Health Initiative, establishing a coordinated multi-agency effort to improve access to care across the nation. Yet for all the progress we have made, we know that more must be done. In 2009, the last year for which we have complete data that is available, more than 16 million American children went without dental care. That's not acceptable. Our nation has made significant progress in improving children's dental care in the 5 years since the death of DeMonte Driver, but there's still much work to be done. Case in point, last summer, 24-year-old Kyle Willis of Ohio died from an untreated tooth infection that spread to his brain. In fact, the health of millions of Americans is jeopardized because they cannot get treatment for tooth decay. The access problem has become so severe that many people are forced to seek treatment for tooth pain in the nation's emergency rooms, increasing the overall cost of health care and receiving uncoordinated care at the least cost-efficient setting. In fact, many people seek treatment in emergency rooms for tooth pain than they do for asthma. The Pew's Children's Dental Campaign produces report cards that grade the states on 8 policies that are evidence-based solutions to the problem of tooth decay. Maryland received an A grade in both reports for meeting and exceeding these benchmarks, which includes dental salient programs, community water fluoridation, Medicaid reimbursement, enrollment, and collection of data on children's dental health. This is even more striking, Mr. President, because in the late 1990s, Maryland had one of the worst records in the nation regarding oral health care for its underserved population. But in 2011, the Pew Center of the States ranked Maryland as the top state in the country for oral health. However, the access issue remains. As Mrs. Driver's effort to find care for her son showed, low-income families have great difficulty obtaining care due to a shortage of dentists willing to treat Medicaid patients. Nationally, the National Health Services Corps addresses the national shortage of primary care oral health providers in dental professional shortage areas by offering incentives in the form of scholarships and loan repayments to primary care dentists and registered dental hygienists to practice in underserved communities. I will continue to work to increase funding for grants to states and expand training opportunities for dentists. We do not have enough professionals who are trained and available to treat children and adults with dental problems, and it's our responsibility to fix it. And we must improve reimbursement to dental providers in offices and clinics so that no one who needs dental treatment will be turned away. Mr. President, I would like to conclude my remarks with congratulatory wishes to Mrs. Elise Driver. For as painful as DeMonte's passing was for all of us, nothing compared to the loss of one's own child. Yet Ms. Driver has worked hard, and she has been awarded a dental tech degree. She is now out there helping others with dental care. She will be going back to school next month to receive training in radiology. Yes, in Maryland and throughout the nation, there are signs of hope for the future of oral health care. February is National Children's Dental Health Month, and I want to express my appreciation to the many nonprofit organizations, universities, and providers who are also working across the nation to make sure that we will never forget DeMonte Driver and never forget our responsibility to improving our oral health care for America's children. With that, Mr. President, I would suggest the absence of a quorum.
Clerk will call the roll.
Mr. Akaka.
A quorum call on the floor of the Senate as senators continue negotiations on the surface transportation measure. There is talk of an agreement on amendments to the bill, but it's unclear what that might be. As soon as we find that out, we will pass that on to you. Certainly. Earlier today, the Senate did reject a Republican effort to roll back President Obama's policy on contraception insurance coverage. It would have been tucked into the transportation bill, which they've been working on for at least a week and a half now. It was defeated 51-48. And that amendment would have allowed employers and insurers to opt out of portions of the president's health care law that they found morally objectionable. That would have included the law's requirements that insurers cover the cost of birth control. So general speeches continue in the Senate as we hear time to time remarks on the transportation bill during the afternoon. The House has wrapped up legislative business for the day. In fact, they are out until Monday. They'll be back at noon Eastern. Legislative business will start at 2 p.m. Monday. And among the bills next week, a couple of measures Republicans say will spur job growth. You can see the House live on our companion network, C-SPAN.
Thank you.